If the patient has a hemorrhage, there are basically three different kinds of hemorrhages, many different kinds, but it depends on whether we think the hemorrhage is due to rupture of an artery in the brain, rupture of an aneurysm. That kind of a hemorrhage would probably require an arteriogram using the room such as what we have here to find the location of the aneurysm, which is basically an abnormally dilated blood vessel in the brain that's ruptured. So we can find the cause of the hemorrhage and then figure out a way to treat it. Sometimes the hemorrhage or the ruptured aneurysm can be treated without surgery by putting in little coils. Again, it's another branch of interventional radiology. There are people that specialize just in interventional radiology of the brain. Sometimes the hemorrhage is inside, not the arteries that supply the brain, but inside the brain itself. Those are much harder to treat. They can be on the basis of high blood pressure, patients that have blood thinners that are not exactly adjusted properly, or they have a reaction to the blood thinner. That kind of a hemorrhage requires conservative management, just observation in the hopes that it gets better. In some cases, if the hemorrhage is large enough, the hemorrhage requires surgery. There's another kind of hemorrhage that is the small arteries on the surface of the brain. You may have heard about the actress who was skiing and wasn't wearing a helmet and hit her head. That's called an epidural hemorrhage, which is a small artery on the lining of the brain. That kind of hemorrhage is a life-threatening emergency which requires immediate surgery. So depending on the size of the hemorrhage, the location of the hemorrhage, the age of the patient, different treatments can be instituted. But again, that's just a small subset of stroke patients. So the most important thing to determine when the patient comes into the emergency room, is it a hemorrhage that's caused the stroke, or is it atherosclerosis that's caused the stroke?